everyone, and welcome to another episode in Meet the Venture series for the BLab 2020 cohort. Today, we're here with Justin, Matthew, and Michael, founders of Cress Health, a venture that develops technologies that enhance personal mental wellness. So, to start us off, why don't you guys tell us a little bit more about yourselves? So,
Sure. So nice to meet you. My name is Justin, and I am a rising senior at Brown. And I'm right now double concentrating in computer science as well as health and human biology.
Hi, my name is Matthew. I'm a rising junior at Brown, and I'm studying um, economics and biology.
And I'm Michael. I'm actually a rising senior at Hofstra in their biomedical program. They're studying biology.
well, it's a pleasure to meet you all. So, how did the three of you meet? Well, it's
Yeah. So actually, funny enough, Michael and I are from the same area and we went to the same high school in Long Island. So that's how we really got tight. We basically hung out in high school and we really, saw that we had similar interests, which was the intersection of healthcare and business. And then actually, coincidentally, I actually met Matt during his senior year of high school during ADOC. So that's how I met Matt. And we basically hung out a lot and we realized we really had similar interests, again, healthcare and business. And yeah, that's how we all just started to get close and that's how we all started to really click.
wow, that's so cool. So clearly, you guys go way back. So tell us a little bit more about your venture, Cress Health.
Sure. So Cress Health is a mental wellness venture that's really hoping to really tackle one of the most overlooked problems right now, given the current COVID-19 pandemic, which is healthcare worker burnout. So we basically developed a new type of self-care app that helps healthcare workers self-care easier. And we do that by improving their mental wellness and reducing burnout through peer support, through personal journaling, and analytics/insights.
Well, doesn't that sound great? So when did you know you wanted to start your venture?
So
Well,
actually, Cress Health initially started off, I would say, my sophomore year. So um, that'd be around like March 2019. And we initially started in the addiction recovery space. So we really got our feet wet and we asked around for recommendations from treatment center directors and really tried to create an app to help individuals going through addiction recovery. But then, as we started to really expand in this field, we realized that, it was a bit crowded and we weren't sure if we could really make as great of an impact as we wanted, given the current state. So actually, what ended up happening is, me and Michael and Matt, we're actually all part of combined medical programs. So we're all aspiring physicians. And we all just realized like at one point that healthcare worker burnout was an incredibly big issue that really was concerning to us and that really honestly inspired us to really take action just because we had a couple mentors at the time who kind of just let us know about the state of healthcare and how the workforce was feeling so burnt out and demotivated. And we realized that this was a problem that had really terrifying downstream effects on the productivity of our healthcare system, and that affects all of us because all of us are at one point in our lives patients, right? So what we realized is that there was this huge problem with healthcare worker burnout and that it would affect us in the future as aspiring physicians. So that naturally made us realize that, hey, we should try tackling this. We were already at the stages of maybe pivoting from addiction recovery, and that's actually what really, I guess, catalyzed our transition to this particular space.
that is
So
certainly very interesting. So though this may seem a little bit intuitive, why is this issue within healthcare so important to you guys? That is certainly
Yeah, so as Justin alluded to before, because we're all aspiring physicians, and we've actually, interestingly enough, always had an interest in psychiatry and psychology, especially. So, especially since this is sort of our career aspiration, this field is really important to us. And we just really couldn't um, see ourselves entering the field knowing that this was the problem. And as Justin kind of alluded to before, especially with the arisal of the COVID-19 pandemic, this issue is really, finally getting the attention that we believe that it deserves. Um, Personally, I'd say that we've been trying to tell people about this problem, increase awareness for it for the past at least half a year, but it's not really until these past couple months that the general public is really getting a picture into the state of how things are really going on. And especially with COVID-19, healthcare workers are facing record levels of stress, trauma, and burnout. And, unfortunately, we've really reached a point with, unfortunately, healthcare workers and top physicians in New York taking their own lives and really dying by suicide. So this really has propelled to the forefront of our attention. We really need new innovative solutions in order to really address them, just to prevent terrifying long-term effects that this could potentially have, really, if more innovation doesn't occur in the space. And what really is driving us right now is us realizing that a lot of the focus right now is really on protecting the physical wellness of our healthcare workers, through PPE, through increased masks and things like that. But really, limited attention has really been placed on the mental wellness, and that's what we're really trying to do, and why we're really driven to work day and night on this venture during the summer.
Well, that is certainly a very important issue. And are burnt out physicians your target market? Burnt out.
Yeah, so we designed our product specifically to help the mental health and mitigate burnout for healthcare workers. This includes physicians, nurses, PAs, really anyone on the front lines in the healthcare system. And we really think this is a huge market because we estimate that there's about 20 million healthcare workers right now. And after our conversations with a lot of healthcare workers from all these different specialties, we really see that there's been a lot of sort of validation for what we're building, and we're really excited to get our app into the hands of these people as soon as possible.
Yeah, and I guess just to add on to Matt, really something we've always been saying at Cress is that we believe that everyone deserves support, regardless of your circumstance, regardless of your socioeconomic status. And really, what drives us is that we really want to be able to democratize support so that it's accessible to everyone. And, inclusive in this mission, like Matt said, we want to make sure that everyone across the healthcare spectrum right now, we're all in this as one team, really fighting this pandemic together and fighting this crisis together. We want to make sure that everyone can get that support that they need and really validate all the hard work that everyone's putting in.
Well,
Yes.
that is certainly a very inspiring message. And what are you guys working on right now?
So right now, we're currently in the pilot stages of our venture. So we actually have a really, really close upcoming pilot with one of the largest healthcare systems in Illinois, Chicago. And yeah, we're currently at the stages where right now we're really trying to plan that out so that we can hopefully get, good outcomes with regards to like rate of burnout, also like other productivity outcomes relevant to healthcare workers, so that we can show that our app helps them, not just mentally, but also in terms of their productivity, which is really what, the higher ups in the hospitals really care about. So that's something we're working on right now.
Well, that is certainly exciting. And what is something surprising that has happened so far in the development of your venture? Well,
Yeah, as I alluded to earlier, I think one of the most surprising things so far has been sort of the positive reception we've received from all of the healthcare workers that we've both talked to about our product and shown our product to. A lot of the healthcare workers are in need of this confidential and anonymous peer support and personal journaling that we offer. And we're pretty different than all of the other support options out there right now. So we're working really hard on developing our app right now this summer, and hopefully we can start getting our app into the hands of healthcare workers.
And how do you think BLab will help you achieve that? And how do
as kind of like pre-medical students, right? We know most of the clinical and more medical related, background needed to start a venture like this, right? But what we really lack is that business sense. And that's something that we're really trying to work on, especially because, right now we've predominantly focused on product development, but now we're getting to the stages of really wanting to scale our venture so that we could get our app into the hands of all the healthcare workers in the US by the end of this year. So basically, what we think BLab will help us with is really honing in on this business expertise. So all of the workshops you're doing, like revenue modeling, like all the legal stuff as well, will really help us with regards to building up that expertise. And again, also what's really important about BLab is the mentorship and support. Jason, Jonas, Liz, Abby, they're doing an amazing job really trying to nurture us as ventures, because we are very early stage still, and we still have a lot to learn. And we still need, the support and the expertise and the advice from experts who've done it themselves, from entrepreneurs themselves. So we think that that mentorship will really help us as well.
Yeah, then just adding on to Justin's response, especially for me not being a Brown student, this has really been sort of my, first experience with the Brown community. And I gotta say, it's amazing. Everyone is so kind, so really helpful. So, personally, from almost like an outsider's perspective, I think what I'm most excited about is really getting to know like the entire cohort. Everyone's amazing. It's so cool just to see what everyone's working on and really making like amazing social impacts at the same time. So yeah, that's what I'm really personally really excited about.
Well, we definitely look forward to seeing you around campus once this is all over. Is there anything else you guys would like to share with us before we move on to our final question?
Yeah, definitely. So I guess one thing we really want to share is right now, we're really focusing on healthcare worker burnout, how to get our product into the hands of as many healthcare workers as possible. But in the long term, as Cress Health, we really hope to make products for everyone to help everyone's mental wellnesses. So not just healthcare workers. That's kind of like our initial space that we're really trying to make the most impact in. But eventually, we really want to make products for everyone. So just wanted to put that out there.
Well, we'll be sure to keep an eye out for that. So, just to conclude, what's the latest TV show you've been binge watching in quarantine?
Yeah, this is an awesome question. I had always heard from all my friends that The Office was the best show, but I gave it a watch, like I think my sophomore year of high school, and I hated it. I couldn't even get through the first episode, but I started watching it again like 5 days ago, and I'm already on like season 3. I've been watching like 5 episodes per day. It's awesome. So yeah.
The Office is an amazing show. I love it too.
Yeah, then I guess for me, I've been rewatching Avatar: The Last Airbender. It's a great show. I've been watching it a few years. I'm really happy it's on Netflix now. But I think something like that's really cool is that obviously it's a kids show, but rewatching as a like a semi-adult, there's so many like deep themes, right? Like when they're like Boston Say, it's like this like police state. I think it's just so cool just to really like have this entirely different perspective, like rewatching it like one more time, like when I'm older. So yeah, definitely highly recommend.
I feel like it's no longer a kids show. It's a show for college students.
Exactly.
Definitely. I completely agree with both Matt and Mike. Those are amazing shows. Personally, for me, I've been really feeling Silicon Valley these days. I didn't have the opportunity to watch the last season, so that's what I've been actually watching a lot. And it's super, super ironic as a show. It's basically a parody of Silicon Valley. So it honestly has those moments where I'm just like, laughing like my butt off just because of how kind of just, like it's kind of how just out of ordinary it is. So that's something that has really got my interest these days.
Well, thank you once again for meeting with me, Cress Health, and you've just listened to another episode in our Meet the Venture series for our BLab 2020 cohort. I'm Fabiana Sarkis, and we'll see you next week. Thank you for tuning in.